Hello, dear guys. Topic of our lecture: modern principles of organization and methods of medical and preventive care for children. And of course, we will speak about historical role of scientists. Pediatric dentistry is one of the most complex disciplines. She studies dental diseases based on knowledge from the age-related anatomical and functional characteristics of the child, its development of all period of life. The child population makes up a significant part of the population of our country. Therefore, the sphere of assistance concerns of a promising part of society. One minute, sorry. The level of dental diseases in children extremely high. Now we will speak about some cases from this slide. Here you can see decay, and you can see diseases of gums, diseases of mucous membrane, and of tongue. Painful condition of the oral cavity is bad affects psychological and physician-child status. From toothache and discomfort in the mouth, from inferiority of the dentition, the child refuses to to eat, chews it badly. Untreated teeth always are a source of infection, of course, allergies, and reduce the body's resistance as a whole. Diseased temporary teeth are the cause of 85% of severe purulent inflammatory processes and leading to tooth mandibular deformations. Pediatric dentistry has a long history, enriched with both scientific achievements in the field of medicine and technology and the practice of their implementation. Implementation as well as knowledge of physiology and pedagogy. Condition and the ways for the further development of dental care for the child population were identified back in 16th years of 20th century, and as a specialty, pediatric dentistry were formed in 1984. However, the system of providing dental care to school children has a long history. In 1886, Limburg organized the first free dental outpatient clinic for school children. And at 1896, under his leadership, a project of dental care for children was created, which became the basis measures for the planned rehabilitation of the oral cavity in school-age children. In the early 30s, four types of dental institutions functioned in the country. Independent dental outpatient clinics, factory schools. Next one is dental offices at dispensaries and hospitals. Of course, it is private dental offices and dentures. When organizing the work of dental institution in cities, it is necessary to combine well-known principles. First principle, it is decentralization, and second principles, it is decentralization in providing dental care to the population. When centralized form, the reception of the population is carried out directly in the dental clinic or clinic in the dental department or dental office of the territorial polyclinic. Organization of work of the dental polyclinic, it is equipped with modern and very good equipment. Next one, qualified staff and provides the highest quality of medical care. The children's dental department works mainly by the method of planned rehabilitation. This method is implemented in two steps. First stage, it is inspection of oral cavity, it is dental examination. Determine the need for various types of dental care and its volume. Second stage is providing the necessary medical and preventive help as soon as possible until complete reorganization. In the significant part of courses, planned rehabilitation involves. And the third stage is the following systematic active monitoring of patient. It is dispensary observation. And the most important condition for improving the quality of dental clinic is clear conducting medical accounting and reporting special medical documentation. Next one is ability to analyze statistical data and on their basis to develop measures to improve health care. Here you can see some examples of special medical card, and we will speak about medical card soon. Decentralized the form service provides for the creation of permanent dental offices at enterprises in higher and secondary educational institutions, schools, etc. The advantages of this form, of course, there is the possibility of full medical care for employers or students. Next one, this service to the population takes place on the spot and constantly. And the last one is closer contact of the doctor with the patient. Look please, decentralized form of dental care prevails in the provision of dental care to children. Dental education and hygienic education of school children. I'm sorry, I have some technical problems. Hygienic education of school children carried out in the form of a special lesson. Children are taught about the main causes of caries, periodontal diseases, gum diseases, method of preventing these diseases. Each lessons lasts, for example, from 30 to 45 minutes. All classes are conducted taking into account the psychological characteristics of different age group, grades from 1 to 4, grades from 5 to 9, and grades from 10 to 12. It is example of health lesson in Kiev in school. Age group Index age and age groups. Please look. It's very necessary information. 5 years. It is between from 5 and 6 years of age. Maybe 6 or 7. And next one is 12 years old, 15 years old, and so from 35 to 44 years, and from 65 to 74 years. About the prevalence of caries, so low, it is more than 20% of children have healthy teeth, and moderate from 5 to 20% of children have healthy teeth, and high less than 5%. Examination, general principles, and contact with a responsible person, login and pre-workout, sources fluorides, and viewing a registration card. Conducting a survey, dental examination. So registration card. Registration card. You can see examples from card that we used in our practice in Ukraine. Here you can see first formula for permanent teeth, and second for temporary teeth. You can see some sextants. First, second, third, and fourth. And the same in this formula. 1, 5, 6, 7, 8. And when you're doing dental examination with your patient, you should write in the card this information about teeth, about dental diseases, and about teeth, number of teeth that you can treat. For example, you should treat tooth number 1 and 6. Understand? It is a first sextant. The second sextant, for example, you can, you treat tooth 24. Okay, but in children, in the temporary teeth, we use number 5 in the first sextant, 6 in the second sextant, 7 in the third sextant, and 8 in the fourth sextant. Please remember. A registration card. First of all, it is dental status, yes, and this card includes the following sections. General information, it is extra oral examination. Then it is assessment of the temporomandibular joint, condition of the mucous membrane, spotting or maybe some diseases of enamel or dentin, systemic diseases, for example, hyperplasia of enamel, for example, fluorosis of teeth, condition of periodontal tissues, indexes, yes, loss of attachment, and their condition of the teeth, and the need for treatment. And of course, orthopedic status, orthodontic status, of course, you should write in the registration card. It is card that we use from a World Healthy Organization. It is all information about patient, date of her birthday, yes, of here doctor should write name, surname of patient, Here, of course, we should know a number of phone of patient, where our patient live, and here you can see different tables. Mm, First tables, it is diseases of mucous membrane. It is first table, yes. Second table, it is different defects. It is different diseases of enamel, of dentin, fluorosis of the teeth, and it is a periodontal index. And here you should know about cement and enamel joint of the teeth. Here we write about gums. Here you can see special tables for teeth. And you write here all teeth that the patient has, and near the number of the teeth, you should write diagnosis. For example, if it is caries, you should write letter C. If it is for example, periodontitis, you should write letter P. Here we write different diagnoses. And if you see, for example, orthopedic crown, you should write, of course, orthopedic crown. If you see that extraction of the teeth were in the inpatient, so you should write letter E, extraction of the teeth. It is orthopedic status, and here in this table, in the last table, you should write need of the orthopedic treatment. And different orthodontic animals. Here we write bite that patient has, and here you can write need your patient, for example, some help from other specialist or not. Registration card, please look in these pictures. You can see enamel spotting, yes, and hyperplasia. It is cells 43, 52. It is cells in registration card. And please look if you see. It is white spots. It is hyperplasia of enamel. Registration card, clinical evaluation, enamel spotting, yes. And here we have are the cases. Please look. White spotting. And here, this very hard form of enamel spotting, of hyperplasia of enamel. And please write in your synopsis that we write this information in cells 43, 52. Dental fluorosis. If you see this white, this yellow, spots on the teeth, it is fluorosis. And cell for this information 53. Here you can see different form of this disease. Yellow spots and here you can see yellow enamel and white spots on all of these, and it is and in the last page is very hard form of fluorosis. Registration card, communal periodontal index. Cells for this index 54, 59. Please look. It is communal periodontal index. Here you write information about this index. It is cells 54, 59. Especially designed easy CPI probe from ball at the end, diameter 0.5 millimeters. What has black bezel between 3.5 and 5.5 millimeters, and black rings on the level 8.5 millimeters. From the tip probe, 6/10, the oral cavity is divided into 6/10, which include the following groups of teeth. First, it is from 18 to 14, next one from 13 to 23, from 24 to 28, and from 38 to 34, and the last one 33 and 43, and the last one 44 and 48. The sextant is examined only if it contains 2 or more teeth that cannot be removed. Registration card, communal periodontal index, and index teeth in adults 20 years and other. The next 10 so-called index teeth are examined. Please look numbers of teeth. And patient under 20 years old examine only 6 index teeth. It is 16, 11, 26, 36, 31, and 46. When examining children under 15 years of age, measuring the depth of pockets should be excluded, and only bleeding and calculus are recorded. Communal periodontal index, it is points and codes. So first, there is bleeding, spontaneous or after probing, visible when using a dental mirror. Second, it is stone found during a sounding, but the entire black area of the probe is visible. There's a third, it is a pocket from 4 to 5 millimeters gingival margin in the area of the black mark of the probe. 4, it is a pocket 6 millimeters or more, and 10, it is the sextant is excluded, and 9 registered. So it is communal periodontal index, and you can see different pictures. And here you can see work part of instrument periodontal probe. You can see periodontal probe and sulcus of gingiva. Dispensarization. This is a differentiated organization of care with preventive examination that are reasonable in terms of frequency and a dynamic observation with active treatment in identifying the early stages of the disease. Main stages. Stage first, it is selection and formation of dispensary observation groups. The child's medical history is indexed according to the state of his health. The general condition of the child is assessed according to the medical record. In pediatrics, it is customary to distinguish five health groups from and healthy children rarely get sick. A1 children at risk of somatic diseases, born to mother who had a pathological course of pregnancy or who were ill all the time, with a tendency to frequent RVE. Yes, it is respiratory viruses and other diseases with inhibited physical development and low of overweight. Children who get sick more than 5 times a year. And next group, it is chronically ill children with compensated course of the disease. With developmental defects. For example, from during the period of remission, they are on a general diet or physical activity. Exacerbation and other diseases are rare. The general condition is satisfactory. Next one is chronically ill children with developmental defects in a condition subcompensation. And the last one is chronically ill children with decompensated the course of the disease, with severe malformations and disabled people. So children who belong to groups and practically not attend to kindergarten or to school. Allocated three dental groups of dispensary observation. So it is dependent on the dispensary group. Children must be examined and require treatment. So we don't know it respectively from 1 to 3 times a year. To assess the state of the oral cavity, the degree of activity of dental pathology is determined. First is compensation, second subcompensation, and the third decompensation. The degree of compensation of the process is known. So Arabic numerals 1, 2, 3, and the first letter of the name of the disease. For example, C. caries, periodontal diseases, development anomaly, and surgical pathology if patient has this pathology. Then quantitative criterion is dental caries intensity index. The degree of activity of the course of caries in children of different ages. On this table, we should write index of intensity of caries. It is index when we know about a summary of teeth that has, for example, caries or fillings or extracted teeth. Preschoolers, it is index D plus F, so decay and fillings. Student, it is only for temporary teeth. Next one, students from 1 to 3 grades, index D, F, E. So big letters, it is for permanent teeth. DFE plus DF. So DFE permanent, it is DF. Small letters, it is temporary teeth. Understand? So if, for example, patient in registration card has information about 3 fillings and, for example, 1 caries, you should have summary information from this index. So 3 plus 1, it is 4. Intensity of caries in these children, 4. Next one, student from 4 to 8 classes. Of course, DFE plus DF. So here, first group, second group, compensated and some compensated. 7 main factors risk the most significant the development of caries, periodontal diseases, and a variety of anomalies. Major risk factors for development caries. Of course, it is excessive viscosity of saliva, yes, and acidic reaction of saliva, a tendency to an increased assimilation of dental plaque, subject to the observance of the normal hygienic regime. And fourth, it is hyperplasia of enamel, which indicated defects in the development of the tooth and reduced resistance of its tissues. Then premature teething for 6 months or more for temporary, and for 1 year and more for permanent. Genetic predisposition, and gystosis pregnant, so early gystosis affects the formation of temporary teeth and later permanent teeth. Major risk factors for development. We speak about this, yes. Increase saliva viscosity, acidic reaction of saliva, significant accumulation of plaque, caries of gingival localization or anomalies of soft tissues, and anomalies of the position of the teeth, dentition and occlusion, and biting and chewing with inappropriate groups of teeth, as well as unawareness occlusal contacts. With considering classification of diseases and causes, they were conditioned. Optimal should be considered, such a structure of mass dental clinical examination. The composition of dispensary groups depending on the somatic and dental condition of the child. And different groups overview. So first group overview 1 time a year, second 2 times, and other groups 3 times in a year, sometimes more. Next one, the dispensary group includes children from 1 to 3 healthy group that do not have dental pathology, have risk factors for the development of caries, diseases, periodontal diseases, and different anomalies that compensate a decrease of caries activity and of periodontal diseases. And children, regardless of their general health, in which revealed any signs of anomalies in the development of the maxillofacial skeleton or malformation that are subject to surgical correction. The second dispensary group includes children from first to third group health and stock compensated caries, gingivitis, periodontitis, children with serious health conditions, yes. It is a risk of major dental diseases from compensated by the form of damaged teeth and periodontal. and children from different general health conditions, from chronic recurrent stomatitis is observed, and chronic diseases of the salivary glands, uh, mm, benign neoplasms. The third dispensary group, children, regardless of their health condition, have compensated form of caries and periodontal disease and chronic required lip cracks, past malignant tumors or now tumors. Children of 4 to 5 health groups, even with a subcompensated to degree of activity by the form of caries or periodontal pathology. In carrying out this work, it is of great importance, preparatory stage, whose task is preparation and execution of documentation. Child development stories appropriate to label. Well-known wrote that of paints, so green, yellow, and red. I'm sorry, 1 minute, because I have some technical problems. Sorry, guys. The task of the second stage is the transition to medical examination. This stage includes a use of means of primary prevention of caries, expanding the arsenal of means and different methods of secondary prevention of caries, and expansion of the contingent of children subject to clinical examination. The dentist solves this task together with the pediatricians at all age periods. The timing of the dispensary examination depends on belonging to a particular dispensary group. So first it is once a year, second 2 times a year, and third 3 times a year. Stage 3, it is prevention in the medical examination system. This stage includes a holding group and individual prevention with considering and health groups, his physician development, and condition of the oral cavity. Stage 4, rehabilitation in the clinical examination system, is carried out according to the principle of distribution of the surveyed contingent of children after the initial study into 3 main groups. First healthy, second healthy, but with some risk factors for the disease, and third, it is person with diseases and pathological process are formed. Stage 5, study of the effectiveness of clinical examination. First, it is organization efficiency, or their completeness of the coverage of children, yes, of coverage for the year by dispensary observation of children in relation to the number of children in the team. So please write this information in your synopsis. Stage 5, study of the effectiveness of clinical examination, medical effectiveness. First, it is percent of children in need of sanitation from those who passed the examination, and percent sanitized children from those who need it. The number of cases of complicated caries from 1,000 children. In temporary teeth, in permanent teeth, it is separately information. And number of removed permanent teeth from 1,000 children. Number of conditional labor units worked by a doctor to a day, yes, during a day. And the number of cases of refilling due to poor quality condition of the filling. An increase in the intensity of the development of caries. and number of teeth with initial caries develops rapidly. Thank you for attention. We wish you success in new academic year, and we are glad to see you in our department.